Really what I think happened that I could pinpoint, and I touched on just a little bit earlier, was the Blake decision. When it came down, I believe it was 2021. And with that ruling, it basically came through the Supreme Court, which overturned a conviction with this young lady whose last name was Blake, hence the Blake decision, where she said she knowingly didn't have that drug on her because she had borrowed her friend's pants. So they threw that conviction out. And really what we could have done, the legislature could have easily fixed that by just adding the word knowingly into the legislation, and they never did. So then we came about with a whole different law that we still had to revamp from there. But a lot of that was done, I think, when the Blake decision came through, and Rep. Klicker hit on it, was during the COVID years. There wasn't a lot of interaction with legislators because many were remote, some were in person, and there was not much interaction with the public when for 2 years a lot of these laws that we say could be bad laws came through.
All the above. And maybe some others. I think the country is facing a crisis. I think we've lost a lot of our willingness to have some tough love type measures. And we are a very forgiving society, and I think that there are ideologies and mentalities that have shifted us a certain direction, and I think that's kind of where we've been heading. We're still unfortunately heading that direction. We've been very soft on crime. There had been a push for legalizing narcotics, and by doing so it will enhance or create, get other countries such as Mexico and China and whatever to push these drugs in more country, and until we can get a grip on that, and unfortunately have to start taking some measures that will be a little bit tougher to take care of our crisis, we're going to continue down that dark path.
So tell me about some of the specific legislation that y'all have either worked on in the past or are currently working on that could concern fentanyl or the opioid crisis in general and could help that situation.
Well, it's currently, I'm personally not working on any legislation. It's really difficult because when you introduce a bill, and depending on who's in charge and what party's in charge, and currently the Democrats have been in charge for really since in the House since 1999. The governor's been in charge since over 40 years. It's difficult to introduce certain legislation that would be able to help these matters out, because any laws that you pass, you have to fit within the parameters that will allow a hearing, and then if they want to execute it out. And so we can work on some different legislation, but will it get anywhere? It's got to get past the chair of each committee, and that's where we sit on this. Currently, the chair of the I think it's Public Safety Committee would be Representative Goodman, and he is pretty soft on a lot of the drug issues and the crime issues.
I think one of the bills I think that Rep. Klicker is referencing to with that committee, it was Senate Bill 5010, and it actually was introduced 2 years in 2023 and also again in 2024. That's a Senate bill. Both years it cleared the Senate off of the floor, so it went through committee, cleared off the floor to be passed on to the House 48-1. It got to the House, it died both years in committee, which is that committee chair. It was in the Community Safety, Justice, and Reentry Committee. And that committee chair for the House basically killed the bill, wouldn't get it out of committee to even be heard on the floor for the full body of the House chamber. So that's just a clear example of one person that had that much authority as a committee chair when it clears one of the chambers almost unanimously.
And that's the problem we run into, and like I said, it really, anything you introduce, any legislation somebody in the minority party introduces, doesn't matter if it's Republican or Democrat, the majority party has the reins. They're the ones that control both what legislation they want to see, and if it's within their parameters, they'll get a hearing on it. Otherwise, it's one person that will stop the legislation if they want to, and you won't even get a hearing out of it. So it's difficult. You have to pick and choose legislation that'll work currently, the way the environment is, with the laws that are being passed, and we can see it with the Blake decision. You can see it with the original Pursuit decision. It took the will of the people to have an initiative that was sent to the legislature to vote to repeal that Pursuit law. And so that's what we have, is the will of the people. And that's the only, I guess, tool we have for the most part. We can start introducing, we can continue to introduce legislation, take small bites out of it, but they have a watchful eye, and they're gonna pay attention to what legislation goes in and what goes off the floor to the governor's desk.
Now, there's potentially 3 bills that I see here that still may be coming back or that will come up this year. And one of the bills is to add fentanyl to the child endangerment bill that's out there. So it will be adding that as another component of one of the drugs that are on that, which is so important because how many times have we read where a child has died of an overdose because their parents were not, how do you want to say, responsible with their drugs? And so the child gets it and dies. So that's one bill. It sounds like the one that I told you about, potentially that Senate Bill 5010 that passed so well out of the Senate is probably going to try to get picked up again this year. The prime sponsor on that bill has retired, but one of our other senators will pick that bill up and probably try to run it again this next year. So hopefully we'll get some traction on that one. We also, and I think I maybe alluded to you on this before we sat down for this, is to make fentanyl now a felony charge conviction, which it needs to be. It was taken off of that. This is a very, very dangerous drug, and they basically have stripped a felony conviction over all of these drugs. There is no felony conviction on them. The worst you get is a gross misdemeanor. Then there is diversion attempts where if you go to rehabs and stuff, you can get a little less sentencing on it. Obviously, the idea is to help those people that are addicted to it. But there again, too, I think one of the most important things that we have to do is stop the flow of it. And in doing that, it's not the way I see it is it's not the small distributor. When I say small, is maybe they're carrying around 50 pills and selling them. It's the bigger supply that comes in, and the important factor there is I think getting more funding to our drug task force. Remember, Mark, when we had that meeting with at the Walla Walla Police Department when we got out of session, and they were talking about that, and that they need more funding. It's been either cut or is woefully short, and the way their comment was, you got to cut the head of the snake off to get to the problem. We can spend lots and lots of money on rehab and what we can try to do for those that are have an addiction problem, but if the flow keeps coming, we're going to see the effects of it with higher increases in deaths that we've seen in our neighboring counties. And what we see here.
What said a couple things. There's a whole lot to talk about, but referring to what Senator Dozier was talking about regarding children that are fatalities, I have a graph here of critical incidents involving fentanyl in all children and youth from 2017 to 2023, and in 2017 it had 0 deaths, and now it's already climbed up to really an astronomical amount. There were actually 15 fatalities. This is statewide that they've recorded. 15 deaths in 2023 and 42 near fatalities in 2023. 2022 was less, 2021 was less, and I have the graph here that you'll be able to see, but it's unbelievable. And this was just brought to my attention today by a foster parent who is just, it is near and dear to her heart of what's going on. And this is the result, direct result from House Bill 1227 that was passed in 2022, took effect in 2023, and basically this law, it's called Keeping Families Together Act. And I can give you a copy of what it's about, but it takes away from the courts or from the CPS the reasons to, unless the child is could be imminent physical harm, they have to release these children back to a parent. It doesn't matter if there are drugs in the home, they're in a shelter and they're drug abusers, they have to release them. And that is the problem, is that these parents will bring these kids back home. Some of them might be homeless. We have somebody, for example, they just told me we have a homeless person here in our community living in a park with a little infant. And that we're in winter time, and so what's going to happen there? So we need to change these laws, and this law here was introduced by Representative Ortiz itself, and we need to change this bill so we can protect our children. Another problem we have is our court system. We have prosecuting attorneys prosecutors that are trying to, prosecute people that have criminal acts, primarily because of the effects of drug abuse, and our court system is just letting these people go free, putting very light sentences on them, even within our own community, and it really ties the hands of both our law enforcement and our prosecuting department. So we have to create better laws that will find help for these people that are utilizing all drugs, primarily fentanyl, but all drugs, so we can have a safer and better society. And I look at a solution is that we implement a law to where anybody that might be an offender, depending, maybe it's a third strike law, or maybe it's a second time offender or whatever, but these people have a choice that within the law I'd like to see is that people have a choice to be incarcerated for, let's say, up to 6 months to a year, or they can go to choose to go to treatment, to where they not only get treatment, but they learn job skills. They can work their way back into society, but they have to fulfill this treatment, and that would make a big difference. But we have to be able to pass a law. I'm considering introducing that legislation, but I have to know that legislation would have support from the other side of the aisle.
If you think that will help Walla Walla at all, whether there will be any spots for people outside the Tri-Cities?
I actually was going to touch on some of the stuff and that was one, I'm glad you brought that up, on what's coming forward. And I just want to tell you right here, the 2024 budget, and I'll leave you these notes here, you can have them. the 2024 budget this last year, it did contain money for Yakima Valley Crime Lab to do testing of cases, which is something that's really important for us. And so this is more for the Yakima Valley. One of the other things that we're finding out is on the treatment side. So we've had a couple of budget appropriations the last 2 years that have been very important. One's in the Tri-Cities and one has actually been here. I think the one that was for Blue Mountain Heart to Heart, it was I think 2 years ago. When Everett Maroon had put into my office, I don't know if he did for your office too, $515,000.
Yep.
And we were able to get that passed through on both the House side and the Senate side for $515,000 for Heart to Heart locally. When you talk about the Columbia Valley Center for Recovery, this is a tremendous facility. I went to their ribbon cutting for them about 2 months ago, and it's part of the old is a Kennewick General Hospital, I think. 2 years ago through the legislature, and again, these funds come through the capital budget side of requests. So 2 years ago, we were able to, on the legislative side, give them $5 million, and then they needed some more money this last legislative cycle in '24, and we were able to add an additional $1.5 million into that recovery center. And it's going to have a tremendous impact. It still has quite a bit of room to grow. They'll still need more funding. I don't know how many initial beds will be opening right off, but it's going to serve the need for this region, and I think that's why it gained a lot of support, not only from us in the 16th, but the 15th district, the 8th district, the 9th district, because it's just kind of this whole Southeast Washington center that's going to have enough size to it that it's going to help.
Mm-hmm. Yeah, exactly. Yeah, we worked hard, pushed hard to get the funding for that, and especially when, with our state, back then we didn't have the shortfalls we have this year in our budgets. But those are the priorities we need to not set aside, but to put forth and make sure that we have more funding for these recovery centers. It's really important. However, we have to be able to utilize opportunities, and sometimes we have to create those opportunities, and that's what I'm saying. A lot of the people may be offenders. They may be on the criminal side of things. We need to be able to, everybody in society needs help, but maybe we can take it even further than just this recovery center, but look at a statewide program that will be able to help. So many times with people, especially that are tied up in the fentanyl issue, many of them will commit crimes. So we have to find a way to, number one, get them off fentanyl, but we have to be able to find a way to get them, integrate them back into society. That's a great thing with this recovery center. That is the whole goal, is to be able to, and it's not just a recovery center, it's a mental as well, mental recovery center, not just necessarily drug induced. So it's a great program. We're excited to see that move along.
And I don't know if this is something they would know this early in, it being built, but have you heard anything about whether there would be a certain number of beds set aside for people who are coming from outside of the Tri-Cities? Because that will be the closest treatment center for so many communities around.
I don't have an exact answer for you on that, but I'm actually meeting with them this afternoon too, again, to do an interview and for support, I think, and I don't know if they'll be coming to the legislature again. They probably are, because they'll need more funding, and I just happen to have been elected to be on our capital budget committee from the Senate side this year, so a lot of these requests, I'll be able to see that come in, and I think as Representative Klicker said, I think, as you've all heard, it's going to be kind of a tight budget year with things, but I think you're going to see a prioritization of probably expenditures for really important services that need to be out there. And, obviously mental health and addiction is growing very rapidly. And I think it's something that both sides of the aisle, I think, can embrace and try to curb. So it'll be interesting to see where that's
and
going.
I think that's exactly what Senator Dozier said. I think that's what we all have in common on both sides of the aisle is that we want to see recovery. We want to see people, find a way to get out of that addiction they're on.
Maybe just don't agree with means of punishments,
Yeah,
what we're running
right,
into, I
right.
think.
Yeah, that's where it changes. So if we can kind of come together and
Yeah.
find, at least start working on the recovery, but we have to be able to, unfortunately, some of these people that are in recovery, many of them are homeless, some of them just, they don't have any job skills. So we have to find a way to get them back into society where they can they can be I don't know what the word is, be part of society and be able to, I don't have the word for it, but help in society, be a part of it. And so, well, I'm not going to have, I'm not doing very well with words today, so.
I also wanted to ask, I saw that there were a few bills enacted earlier this year having to do with education in the opioid crisis. So I know that now they're requiring Narcan and naloxone in all schools, and there's an awareness campaign where they're teaching kids about the opioid crisis, and I'm wondering what you guys have heard from schools in this area about that, how that's going. Have you heard anything about that?
No, I have not heard directly from any schools here. We have again a meeting tonight with Kennewick, I know that. But a lot of those bills, I'm on early learning K-12, obviously, so they come through the committee that I sit on there. And so there has been a lot of discussion on that. Obviously, Narcan is trying to get made readily accessible to every place, because where you can get it is the schools and stuff, because it can reverse the process so quickly. So it's probably good with the crisis that we're having to have something there to try to keep the deaths away, but definitely again, it's getting rid of the drugs themselves somehow and educating the kids. I mean, the tough thing is, and I think that's where the education part comes in, that's going to be so important for these kids to be able to learn more about the dangers. I mean, a lot of times you don't realize that, it's Oxycontin and what am I going to do? I just need a quick little high, but you don't realize, because you can buy a drug that's a controlled drug. You buy it off the street, you know that it's going to have some issues with it, and that's where I think we're seeing a lot of this.
And I think utilizing and having Narcan available is definitely a need, but we really need to stop the drugs coming in, and that's where our law enforcement does it. If it's the police departments or the sheriff's departments, really need the funding, and we're just not getting the funding coming in for these law enforcement agencies. And for instance, they were able to muster up enough to bring in a narcotics canine, and the Union-Bulletin's written some articles on that, and this dog has just done wonders on getting so many of the drugs, but there's so much more to be done, and so we need more of that. We need more funding so we can help our law enforcement contain some of the suppliers and to get the drugs off the streets, because it comes in all forms. Fentanyl looks like a Skittle, it looks like Reese's Pieces, looks like an M&M, and it's easy for these kids to get it, and that's where you'll find, if you ever get a chance to talk to these foster parents, these drugs are in not only in the school, but they're in the household, and they're breathing the dust. It doesn't matter if it's fentanyl or methamphetamine, they're breathing that. So many of these kids I'm hearing stories that are actually coming into the schools that are high just from breathing the substance. within their own living conditions. And so that's where we've got to get a hold of it and contain that.
I also wanted to ask you all about the opioid settlement. I know Walla Walla County started receiving its payments maybe a year or two ago from the $1.8 million, and that'll go over, I think it's 17 years. And I was just wondering if y'all had any thoughts on where that money needs to go and where it could best be used for our county.
Where does it come into exactly? Who has control of those funds?
I believe it's the county.
It goes to the county,
I
okay.
think so. I could be wrong. I
Okay.
have not reported on this.
You see, okay, because I wasn't sure. I know that back when I was a county commissioner, we had passed the 1/10 of 1% sales tax increase to fund mental health and abuse programs. And at that point, it went, I believe it was like I want to say competitive grant process where you apply to a different entity, and I'm just wondering if this is basically coming in and be a part of that same pot of money. I don't know. That, yeah, if it comes into, is it administered by the health department? Is it overseen by the commissioners? So that I don't know, but that'd be interesting to find out too.
Yeah, for sure. We're gonna try to find out more about that. I think the last time we
Mhm.
reported on it, whoever has control of it, they hadn't really decided. That was a few months ago. They hadn't really decided.
And if you look at it, it's spread out over the years, 1.8 million really isn't, it's almost pocket change anymore.
Yeah, over
And
17.
if it's not put in the right place, it can be absorbed by administrative costs right off the bat. And then,
Now, is
so.
that 1.8 just for Walla Walla?
Just for Walla Walla County.
Yeah, because with the 1/10 1%, we were, back when this was passed, I think 2015, that was going to bring in $1 million annually just with the 1/10 of 1%. So, yeah, that doesn't seem like very much
No,
money.
it's really not.
So, wow.
And also one question that we've been asking pretty much everyone we're interviewing for the story is, what are we missing? What are people missing? Is there anything about the opioid crisis and specifically the fentanyl crisis that you think is being overlooked or is flying under the radar that people aren't talking about enough or don't realize?
You know, I don't know. It seems like it's been such a topic out there. Almost everything seems like it's been touched from just the amount that's out there. That it seems like it's easily accessible.
Hi there. We're in the.
There just seems like there's so much
Hi, are you at the
discussion on it. I'm not sure
Yeah,
what is missed.
just a second.
Other than, again,
Are you at the?
I will continue to say that we need to get funding for
Yeah,
this
we
drug
have
task
a
force.
10:30
forces.
interview. We've been trying to call you, so.
And we definitely need
Yeah.
to look at how we can fund when Rep. Klicker
Did you
touched
wanna run? Are you here
the
close to it
canines.
now? Do you wanna run
I
in?
had a meeting with, not a meeting, but a demonstration with the
Oh,
Kennewick
okay.
Police
Don't worry
Department
about
and
it.
their
We're almost done.
canines.
We'll just.
They don't have any
And
drug
she can call it
sniffing
if she
dogs
has
in
any
Kennewick.
questions, so.
They have one
Does that
dog
sound good?
that is like used for burglary type stuff and, tracking. But I think the cost they told me was like
Yeah,
$175,000
So-
to get started
Just
with them, training and everything. Whereas
All
Pasco,
right, well.
that city of Pasco's, I think got 4 dogs. So somehow, I don't know if this is local funding that they're doing, or if it is coming from, I don't think it's coming from the state. So it may be coming local, some may be from the state. But again, that's something that I would like to look into deeper this next legislative session, is how do we, where are the allocation of these dollars coming from? And how can we increase the allocation for that? Because again, I think we need to get to a cause of the distribution of it. Be tougher on the distribution of it.
Yeah. And I really have almost run out of my questions to ask you guys, but I did also want to ask, in doing interviews for this story, a lot of what we hear from healthcare providers is just that there's lack of resources and lack of capacity, specifically here in Walla Walla, and that's a big problem for them, having to turn people away or,
Mhm.
and I'm just wondering what your thoughts are on that, and is there a way to fix that problem, and if so, what factors all go into that? Because, you know, if it was an easy fix.
Yeah, I was gonna say, that doesn't sound like an easy fix. I can't
Yeah.
even come up with a great idea to.
I think a big part of it is eventually it becomes criminalized, and we have to address that. Some way, shape, manner, or form. We have to address the criminal actions and make our laws a little bit tougher, so we can, because sometimes it's tough love, and we have to help people out some way, and sometimes it's just, you know, they have, you know, programs where they're administrating syringes for people. Is that really going to help, or do we need to find a way to get people off of it? And so there's a number of factors that are playing into this. Do I have an answer? Not at this point. We have to address it. So.
Yeah, so before you got here, I was asking about just kind of the lack of resources here in Walla Walla, lack of capacity. That's what we hear from a lot of healthcare providers, that's an issue they're facing. Is that something that you're hearing about or would want to talk about?
Specific to substance use or
Yes.
general medical?
Yeah, I mean,
Okay.
I know that mental health is a big one too. A lot of mental health providers that I talk to say that there's a lack of resources.
I'm sure that these gentlemen have talked about the recovery center in the Tri-Cities.
Yes.
So that was I think probably the most relevant big project that we were able to support. So I think once that gets up and running, that'll be serving this area of the region as well. As far as like immediate right now, this year need, I don't necessarily have a solution to that. I think these are complicated issues that kind of require long-term fixes.
For sure. And this is a question that I already asked you too, but
I'm sorry, I didn't wait.
You know, you're all
This was
good.
not on my calendar at all.
Oh, I'm sorry, I didn't know.
That's it.
Well, in your time as an elected official, how have you seen the issue of fentanyl grow and change and really start to affect the community that you represent?
Even though it's an issue in Walla Walla County, I feel like we're fortunate that it hasn't kind of overtaken our area like it has in other areas like Seattle and Olympia. Yeah, I mean, I think we're all here to help support the community in any way that we can, and so being responsive to requests and concerns that come from healthcare professionals and people that are on the ground is kind of part of what our role is. And so I had the opportunity to do a ride along with Cody Main and learn about kind of what is it like on the ground and what is his experience seeing the homeless shelter area and hearing actual stories. I think was helpful in just understanding the issue. As far as providing resources, that always comes with a price tag, and if the legislature could be helpful in that area in funding positions or things of that nature, then I think there's still room, even in our tight budget situation, to maybe do some of that work.